Hello everyone, I am Dr. MILTON HASNAT. I welcome you to today's episode of Truth in Transition. As a physician, epidemiologist, and public health expert with decades of experience in disease prevention, vaccination systems, and health program evaluation, I believe I have both a professional and moral responsibility to speak about one of the most painful public health crises Bangladesh has faced in recent years. Today, we ask a difficult but necessary questions. How did Bangladesh, a country once internationally praised for vaccination success, end up with more than 500 measles-related child deaths? And importantly, could this tragedy have been prevented? Let me begin with a heartbreaking reality. At Dhaka Shishu Hospital, a children's hospital, reports described a grieving mother Konika Akhtar collapsing after losing her 6-month-old daughter Risa to measles. Nearby, her twin sister Ruhi fought for survival. Pause for a moment. Imagine that pain. One child gone. Another still struggling to live. And sadly, this was not an isolated case. Reports also emerged of a couple who reportedly waited 11 long years to have a child through IVF, only to lose their 10-month-old baby to measles. There are reports of parents who waited years to have a child only to lose that precious baby to a disease modern medicine already knows how to prevent. This is not Bangladesh during war. This is not a humanitarian collapse after a natural disaster. This is Bangladesh in 2026. Now, as a public health professional, let me say something clearly. Measles is preventable. But measles is also one of the most contagious infectious diseases known to humanity. To stop measles transmission, a country generally needs around 95% vaccination coverage, what we call herd immunity. When coverage falls below that level, outbreaks become not only possible but predictable. This is why data matters. Recently, Bangladesh Health Minister reportedly suggests that today's measles deaths are linked to children missing vaccination 8 years ago. But does the evidence support this explanation? Let us look at Bangladesh's own vaccination record. According to Expanded Program on Immunization, EPI, and WHO UNICEF estimates, Bangladesh maintained consistently high measles vaccination coverage under the Awami League government. 2018, 97%. 2019, 97%. 2020, 97%. 2021, 97%. 2022, 96%, 2023, 96%, and 2024, again, the coverage was 96%. In public health terms, these are exceptionally strong numbers. In fact, Bangladesh immunization program was often considered among the strongest in the developing world. During the COVID pandemic, when many countries struggled to secure vaccines, Bangladesh managed one of the region's most effective vaccine rollouts. Parents across Bangladesh know this from their experience. Children routinely receive scheduled vaccinations on time. So, this raises an important question. If vaccination coverage remained above 95% till 2024, why are infants aged 1 year, 18 months or even younger dying today? Because the official EPI dashboards reportedly shows something deeply concerning. In 2025, vaccination coverage appears to have dropped sharply to below 60% in some areas. And from an epidemiological perspective, this matters enormously. If herd immunity breaks, measles spreads rapidly. This is not ideology. This is science. Critics argue that disruptions in immunization systems, funding constraints, procurement changes, or weak program management following the political transition may have contributed to this decline. If warnings were raised by health professionals and international partners, an important question follows: were these risks addressed urgently enough? These are legitimate public health questions, not political slogans. Because when more than 500 children die in a measles crisis, accountability matters. When investigating further, according to reports, after the political transition and the rise of the interim government under Dr. Mohammad Yunus, a Nobel laureate, Bangladesh changed its long-standing vaccine procurement system. For years, vaccines came through UNICEF, largely funded by Gavi, helping Bangladesh maintain one of the strongest immunization programs in the developing world. Then came a major change. Instead of continuing the established system, the interim government moved to an open tender process, promising greater transparency and efficiency. Sounds reasonable in theory, but what happened in reality? After the delay, bureaucracy, vaccine shortage, stockouts, and when vaccines disappeared, immunization collapsed. A nationwide measles vaccination campaign was cancelled. By early 2026, measles vaccine coverage reportedly dropped to around 59%, far below the level needed to prevent outbreaks. Then came disaster. Measles spread rapidly across Bangladesh. Hospitals overflowed. Children were treated on floors. Parents watched helplessly as a disease that should have been preventable stole their babies. Now comes the different questions. Who made this decision? Who disrupted a functioning vaccine system? Professor Sayeedur Rahman, personal health aide to interim government, reportedly defended the policy shift, saying the old system needed to become more rule-based and transparent, but critics are asking what kind of transparency is worth children's lives. If experts, UNICEF and international agencies warned that disrupting vaccine supply could trigger a public health disaster, why go ahead anyway? To ensure your commissions? Leadership is not judged by intentions. Leadership is judged by consequences. And today, those consequences are measured in grieving parents, overcrowded hospitals, and children lost to a disease that Bangladesh once had under control. Critics call it a catastrophic policy failure, a preventable epidemic, a tragedy written in administrative decisions. Finally, Bangladesh once showed the world under the leadership of Sheikh Hasina, the former Prime Minister of Bangladesh, that even a developing nation could successfully control vaccine preventable diseases. For this success, Bangladesh was awarded twice. So how did we move from success to crisis? I think I have already discussed in detail. As a public health expert, I believe difficult questions must be asked honestly, professionally, and based on evidence. Because data matters, science matters, and above all, children's lives matter. I'm Dr. MILTON HASNAT, and this has been the Truth in Transition. If you found this discussion useful, please subscribe the channel, like, and share your thoughts in the comment section. Until next time, stay informed, stay engaged, and stand by the side of the truth.